Conventional periodontal therapy compared to innovative periodontal therapy. Before I get involved with this, I'd like to give a thumbs up to my colleague Jorgen Slotz, who for many years has taught the concept of disinfecting the mouth using sodium hypochlorite. And also I'd like for to thank him for his corroboration on making this video lecture. On a recent article that he published talks about some added impact that you can have with a sodium hypochlorite solution, because this can disinfect the mouth, killing not only herpes virus but also the human papilloma virus, or the HPV, which is a sexually transmitted disease that often can result in oral cancer. So look at that particular reprint, and it's philosophical as well as educational. So here's my friend Jorgen. 2 thumbs up, Jorgen. Thank you so much for your impact that you've had on me professionally as well as on the dental profession. Now, when we talk about conventional periodontal therapy, these are the basic 4 things that we think about: scaling and root planing, home care instruction, periodontal surgery, and preventive maintenance. When do you do periodontal surgery? To correct the damage done by periodontal disease. And certainly we would like to have shallower probing depths, although we may not be able to get an ideal probing depth. To enhance aesthetics, and here we're talking about periodontal plastic surgery, not only root coverage procedures, but aesthetic crown exposure procedures, which I prefer that term much more than aesthetic crown lengthening, because what are we trying to do? Expose that beautiful enamel. We're not trying to lengthen the crown. And also to prepare sites for implant placement, osseous augmentation, and things of that nature. What are the objectives of periodontal treatment? To create an oral environment that is easier to maintain for the patient to maintain. To motivate the patient to control their own destiny. And we're going to talk a lot about that when we talk about the Miller-McIntyre Periodontal Prognostic Index. What are innovative periodontal procedures? Well, certainly we go back to root planing, but that can be enhanced by the next to the last bullet, the perioscope, which is a newer innovative tool for doing a much better job non-surgically with your root planing. And we do have a video on that you can view on the web textbook. But access flaps. Access flaps are designed, number 1, to get access to the root, to remove the debris, calculus, and so forth that cannot be done by non-surgical therapy. Certainly this can be enhanced by the perioscope, as I have mentioned. But what do we do after we debride the root? First of all, we can do osteoplasty. And osteoplasty is simply reshaping the bone where there are ledges, tori, and things like that, which enhance flap adaptation and give us a better contour of the tissue. And while the flaps are back, and after we've thoroughly debrided the roots, certainly we can add regenerative materials to augment the bone. And we've already mentioned the perioscope. Finally, laser therapy has become very, very effective, although the concept has not been embraced by the American Academy of Periodontology. Nevertheless, laser therapy has been shown to be very effective in treating periodontal disease. So here's the video on the perioscope, which you can view. Later, we're going to talk about the Miller Challenge, and these 4 videos are key to accepting the Miller Challenge. I think that we can brush more efficiently if you look at that video. Number 2, the one on flossing technique. Different flossing techniques apply for different situations. For instance, flossing an unhealthy mouth is different than flossing a healthy mouth. And I think you'll find some keys on that you will find quite interesting. Also, we're going to talk about disinfecting the mouth using the sodium hypochlorite solution, or as I refer to that, the most effective, least expensive mouthwash, terms that really patients relate to. Because disinfecting the mouth is the key to what we're trying to accomplish. And finally, the 4th video is on the importance of cleaning the tongue. if you want to cure bad breath. Because the bacteria on the posterior third of the tongue are sulfur-forming bacteria. And even if you brush and floss and do a great job of cleaning the teeth, those bacteria persist. And if they are not removed and the tongue disinfected back there, you're going to have continued halitosis. But I found in my own mouth, over a period of time, not only cleaning the tongue, but disinfecting it with a sodium hypochlorite has changed the flora in my mouth, and I no longer have those sulfur-forming bacteria. So these are the 4 videos that you need to look at if you want to accept the Miller Challenge. Now, what have we learned about periodontal treatment over the last 50 years? First of all, we thought that bacteria were the end-all, be-all. But what we found is inflammation is more important than bacteria per se. Second, periodontal surgery provides access for thorough root debridement. Third, periodontal disease has a marked impact on the development of many chronic inflammatory diseases. And we've talked about the systemic link basically between diabetes mellitus and cardiovascular disease, but recently other diseases impacted by inflammation have come into view. And this includes Alzheimer's disease as well as Parkinson's disease and other diseases. Also, thorough daily debridement and disinfecting the mouth is more important than periodic maintenance, because the better we clean, the healthier we are when we come to the maintenance appointment. So let's emphasize on disinfecting the mouth, not just on the term plaque control. Finally, the total number of probing depth in millimeters is not nearly as important as the health of the probing depth. And we have a video on that I would urge you to look at, and that is the difference between a periodontal defect and a pocket. And periodontists who have been practicing for 25 or 30 years understand this better than the younger periodontist. Because if you have a patient that comes in with an 8 millimeter pocket, and 40 years later there's no bleeding on probing, there's crestal density on x-ray, and there has been no progression of disease, I submit to you that that is now a periodontal defect and not a periodontal pocket. Now, what are the keys to success? First of all, to motivate the patient to debride and disinfect the mouth on a daily basis. And second, to initiate lifestyle changes that will thwart the development of the chronic inflammatory diseases that we discussed earlier. But how do you do this? I think the most effective way of motivating the patients is to use the MMPPI, or the dental report card, as Bob Levine has come to call that. Yes, I'm prejudiced on this because I helped develop it, but let me tell you, ladies and gentlemen, this really does work. If you're going to use the Miller-McIntyre Periodontal Prognostic Index, here are 2 videos that you need to watch. Certainly you should read the article that was written in the February issue of the 2014 Journal of Perio, and look at this video on here. One of them is the background and the development of the concept, and the second is the clinical application. So look those 2 up. Now here is Bob Levine, who I give credit for coming up with a major change in this. He decided that we would use the term dental report card. And here we are in Vancouver sharing a beer, 2 very good friends. Here is a score sheet that was developed by Dr. Michael Sonic. You'll see his logo in the top left, and you see he titles this the dental report card. And to my knowledge, this is the first time the term dental report card was used. And this points out one thing. I have my score sheet, Bob has his score sheet, and now Mike has his score sheet. This is dynamic. Please feel free to change it in any way that will help you communicate with patients. Now let's look at the line that says date, and this is another important thing, and this is also I want to give credit to my good friend Bob Levine for doing. You'll notice where it says date, it says today. This is where you score the patient at the examination. Then, as soon as you scored the patient, Then you come over and give them a target score to aim for. For instance, if they're a smoker, that's a score of a 4. And if they stop smoking, you can lower the score by 4 and markedly improve the prognosis. And then there are 2 other areas where the patient can be scored later when seeing the dental hygiene patient to see exactly where they are. And if you keep tracking this and the score goes up, this gives you a justification and explanation for why the patient may need some retreatment on that. So 2 thumbs up to Bob and to Michael. But here is something I think, whichever form you use, you should have on the back. And this explains what the scoring is about. It gives the references on it. And I think this should be on the back of any score sheet that you use. It can be mailed to the patient in a pre-appointment packet. It can be given to the patient to read in the reception room before they come back, or it can be shared with them actually when they're in the operatory. But one thing, and this is very important, the patient needs to leave the office with the score sheet with today's score, the target score, and this information so that they may share this with family and friends who are interested in saving their teeth or in making lifestyle changes. As a matter of fact, if I were in practice today, I would give 4 or 5 of these blank sheets for the patients to take out. So here is Michael Sonic. I give 2 thumbs up for him. Michael, you're the first one to use the term on your score sheet, the dental report card. But let's talk about some quotes from my web textbook that I think you'll find interesting. And here's one by Henry Ford, who was the first person to come up with the assembly line and really streamline the way that cars are built. And look at what Henry said. If you always do what you've always done, you will always be what you've always been. Do you want to be what you've always been, or do you want to be even better? And the key to growth is to embrace change. And obviously that is true. But if you want to grow, you've got to change. And here's a quote from John Chaney, the guru that helps me with my computer, who is a computer science major at the University of Memphis. John's worked with me for 2 years on this, and I think he's picked up on something very important. It takes courage to embrace change, but it also requires tenacity. And John knows that I have been tenacious in trying to present the concept of the MMPPI to encourage dentists to do things to enable patients to keep their teeth. And for those of you who don't buy into the concept that I'm showing today, here's a final quote. Ignorance is being unaware. Dumb is when you are aware and don't do anything about it. So please don't be dumb. Try this and give it a chance. I mentioned earlier the Miller Challenge, and here's the Miller Challenge. We've got 2 videos, one on improving the brushing technique, some hints on that, and second, some hints on flossing, one on flossing the healthy mouth and one the unhealthy mouth. So the Miller Challenge is to use my brushing technique and my flossing technique for 30 days. In addition to that, you need to rinse your mouth with the sodium hypochlorite solution. Now, Jorgen has one solution, a fairly strong solution for disinfecting a mouth that is diseased. The one I'm suggesting is a weaker solution of the sodium hypochlorite, which is used in the periodontal healthy mouth, especially to get rid of the sulfur-forming bacteria in the posterior part of the mouth. So what you want to do, brush the way I suggest, floss the way I suggest, and then rinse your mouth. The solution that I use in my mouth is only 1 teaspoon, not a tablespoon, 1 teaspoon to a quart of water. Now, I've been using that for a little over a year in my mouth, and I do not really form any plaque now. But the important thing I have found is that I no longer am concerned with bad breath or halitosis, and I credit that to the sodium hypochlorite. Now, once you've rinsed with the sodium hypochlorite, go ahead and spit that out, but leave the residual amount in your mouth. Then I want you to get a tongue scraper, which you can find on my video, the one that I prefer. It's metal. It's engineered so that you can get well back on the tongue. And this is not something that you swipe on the tongue. Actually scrape and remove that debris. And your mouth is immediately going to feel much, much better. And I think if you'll try that for a month, if you want to stop, that's fine. But I predict that you'll stick with it. And I think you'll share this with patients, because you cannot ask patients to do something that you've never done in your own mouth or do not feel is effective. So go ahead and use that, the metal scraper, scrape it, and then rinse the mouth out vigorously, and I think you'll experience something that you've never experienced. I hope I've given you something to think about, and I hope that you will take the Miller Challenge.